South Korea will begin its COVID-19 vaccine rollout next month. It plans to vaccinate 1.3 million people by March, with the entire population inoculated by November. 106 million doses of different vaccines have already been secured. That's more than enough for 52 million residents. At the same time, the country is battling new coronavirus clusters that are linked to religious facilities. Lim Yun-suk tells us more.
At the news briefing, the KDCA chief Chung Eun-kyung said AstraZeneca would be the first vaccines to arrive in South Korea, and they would be inoculated on healthcare workers and the elderly people in nursing homes starting February. That will be followed by Moderna vaccine for people aged over 65, while the rest of South Koreans will be vaccinated in the third quarter. Now, these will be free for everyone, and the government will be setting up 250 vaccination centers to administer them. Now, the government says South Korea, which has a population of about 52 million, will have enough vaccines for about 56 million people. She said, however, the vaccines would not be able to stop the pandemic from spreading.
코로나19 유행이 단시간에 종식되지는 않을 것입니다. 현재 비교적 접종률이 높은 국가에서도 신규 확진자와 사망자 발생이 줄어들지 않고 있습니다. 방역 대응을 철저히 하지 않는다면 우리에게도 충분히 일어날 수 있는 일이라고 생각합니다.
Meanwhile, South Korea is struggling to contain the spread of the virus at Christian schools across the country. Health authorities say there are more than 300 new infections related to those schools run by international mission.
정부는 관련 시설 40개소에 대한 현장 점검을 실시하였습니다. 현재 운영 중인 32개 시설을 중심으로 검사 명령 또는 권고를 통보하였습니다. 관련 단체 및 시설에 대해서도 선제적으로 일제 검사를 시행할 예정입니다.
The government is expected to announce over the weekend whether it will ease those social distancing rules or keep the current measures in place. And currently there is a ban on more than 4 people gathering. Despite the spike in new infections, the education minister says that schools will start the new term in March as scheduled. Lim Yun-suk, CNA, Seoul.